The preferred and better method, more advanced technique for anorectal malformation for boys, which is done by most top centers in the world, is by the keyhole method. So anorectal malformation is a condition where there is abnormality in the formation of the anus or the rectum. In boys, the connection is often between the rectum and the water pipe, and there is often no hole in the bottom end. In girls, they're often connected to the vagina. The condition I will talk about today is in the boys, where the connection is to the water pipe. Now, the anorectal malformation in boys, vast majority of them has a connection that the rectum is connected to the urethra, and that's further inside the abdomen. The traditional method of surgery for anorectal malformation for boys and girls is to make a big cut in the lower end between the scrotum for the boys down to the spine, and in the girls from the vagina down to the spine. The issue with this is that the cut goes through all the important structures and the muscle that we want to use in future, so that there's continence of the anus. With regards to the traditional method, because there's a big cut, the recovery is so much slower and more painful for the child. The preferred and better method, more advanced technique for anorectal malformation for boys, which is done by most top centers in the world, is by the keyhole method, whereby we put small cuts on the abdomen and a small cut in the belly button to have a look at where the rectum is connected to the urethra or the water pipe. And with the keyhole method, we can disconnect this and repair the water pipe. Once this is disconnected, we can create a small track on the bottom end to do a pull through of this bowel, so that it goes through the muscle complex, so that the boy will have continence in future. This muscle is very important to hold feces in the inside, so that the boy is not incontinent in future. And by the keyhole method, we do not need a big cut. We make small incision, we don't cut any muscles, and we do the pull through and attach the intestine to the bottom end. As compared to the open technique, where there's a big cut, where we cut the muscle, we do the pull disconnection to the bottom end through the big hole, and do the pull through and re-establish the muscle around the bowel, which is quite traumatic, and the outcomes are no better than the keyhole technique. So for parents who have got children, or boys in particular with anorectal malformation, it is best for you to identify a surgeon who is able to provide keyhole or laparoscopic surgery, so that your child has minimal incision to the bottom or the abdomen, and the operation is done smoothly with very little pain, and the recovery is so much better.